Okay, welcome to the deep dive. We've got a really interesting set of notes in front of us today, sent in by you, the listener.
hmm
These are your MSRA revision notes, and they're focusing specifically on, well, a pretty serious topic, rabies.
Yeah, it's definitely one where the details really count. And these notes seem to cover the key things you absolutely need to grab.
Absolutely. So our job here, our kind of mission for this deep dive,
Yeah.
is to take these notes, really sort of strip them down to the essentials.
Get to the high yield stuff.
Exactly. Pull out the absolute core knowledge you need for revision, sticking strictly to rabies. Based on what you shared with us, we'll guide you through the key points.
Right. Think of it as building that solid foundation, zeroing in on what's actually critical for exams and, practice.
Okay, let's jump right in then. According to these notes, what exactly is rabies? What's the sort of core definition?
Okay, so fundamentally, it's a viral infection, a nasty one.
Yeah.
It goes for the central nervous system, the CNS, and this is key. It leads to fatal encephalitis, brain inflammation.
Fatal encephalitis. And how does it typically get into people?
Well, the notes are clear. The vast majority of transmissions are through bites and scratches from infected animals. It's in their saliva.
Got it. Saliva. Okay, so it's a virus. Do the notes give any more specifics about the virus itself, like what kind it is?
Yeah, they do. It's an RNA rhabdovirus.
Mhm.
Specifically, it belongs to the lysovirus genus.
Mhm.
And it has this really distinctive shape that they mention a bullet-shaped capsid.
Bullet-shaped. Okay, that's a memorable visual. And which animals are we talking about? The most common sources?
Globally, the big one is dogs, definitely dogs. But the notes also flag others, depending on the region or, say, travel history. Bats are a big one mentioned.
Right.
Also, raccoons and skunks, they're specifically listed.
And what about the UK status? I see that mentioned here.
Yeah, important point. Rabies is a notifiable disease in the UK. That means if you even suspect a case, it has to be reported straight away, legally.
Okay, good to know. So let's dig a bit deeper into the cause, the etiology. Where does this virus come from, and how does it actually spread inside the body?
Well, the cause is the rabies virus, as we said, from the Rhabdoviridae family. And transmission, again, is that infected saliva, usually a bite. The notes mention the animals again here: dogs, bats, raccoons, foxes this time too.
Okay, so it gets in through a bite, then what? How does it find its way to the brain and spinal cord?
Right, this is crucial pathophysiology here. The notes explain it spreads retrogradely, which basically means it travels backwards along the nerve axons.
Backwards up the nerves.
Exactly, heading toward the central nervous system. That's its route, its highway, to cause the actual disease.
So given how it travels and how it's transmitted, who really needs to be most aware? Who do the notes flag as being at higher risk?
Yeah, the notes outline the key risk factors pretty clearly. Firstly, obviously, anyone exposed to infected animals.
Yeah.
Especially if you're in areas where rabies is, common, endemic regions.
Or travelers to those places need to be careful.
Definitely. Also, people whose jobs involve working with animals, vets, animal handlers, and critically, anyone who might have been exposed but hasn't had their pre-exposure jabs, or, importantly, didn't get the post-exposure treatment quickly enough.
Okay. Let's really get into the nitty-gritty of what happens inside the body, the pathophysiology. Virus is in, heading for the CNS. Walk us through the steps from the notes.
Okay, so virus gets in, it heads for the CNS, causing that severe inflammation and damaged brain, spinal cord. Notes list the sources, again, dogs, bats, monkeys, cats mentioned here too. They also point out the incubation period. It varies a lot, typically 3 to 12 weeks, but sometimes shorter.
So it enters, starts moving. Where does it actually multiply first? And are there signs of that happening?
The notes say it travels along those peripheral nerves to the spinal ganglia, and that's where it really starts multiplying. Clinically, this can show up as pain and that sort of tingling pins and needles feeling, paresthesia, right at the original bite site. That's a really important early clue.
Okay, so it's multiplying there, heading inwards. But you mentioned earlier it spreads outwards, too.
Yes, and the notes emphasize this peripheral spread. It doesn't just go to the CNS. It also spreads out along nerves, reaching places like the salivary glands. And that's absolutely vital because, well, that's how it gets into the saliva.
Making the animal infectious.
Precisely. Ready to transmit it through another bite. That whole pathway bite site, up the nerves, brain, then back out to the salivary glands, it explains both the symptoms and how it spreads.
Yeah, you can see why the bite site might hurt and why the saliva is the danger.
Mm.
Okay, now let's say someone presents with some worrying neurological symptoms. It's not immediately obvious as rabies. What else might be going on? What are the differentials mentioned?
Good question. The notes specifically list things like other types of viral encephalitis, meningitis,
Okay.
and just sort of other general neurological conditions.
And why is it important to keep those in mind?
Well, because a lot of the early neurological signs, confusion, agitation, maybe some weakness or paralysis, they can look very similar. There's a lot of overlap. And while rabies is rare, especially in places like the UK, you absolutely cannot afford to miss it.
Right. Absolutely critical. Okay, let's zoom out a bit. The bigger picture epidemiology.
Yeah.
How common is this globally? Where's the hotspot?
The global burden is, well, it's huge, sadly. The notes quote figures like 25,000 to 50,000 deaths every single year worldwide.
Wow.
And the vast majority of those, they stress, are in Africa and Asia. It exists pretty much everywhere except Antarctica, but it's really prevalent in developing countries.
And the UK situation, you mentioned it's not endemic.
Correct. The UK is non-endemic. The virus isn't generally circulating in animals here, except for that specific risk from bats we'll come back to.
No.
Human cases are very rare, almost always linked to travel. Those strict pet travel rules, they're there specifically to keep it out.
Have there been many cases brought back from travel?
The notes mention 25 travel-linked deaths since 1946. And, importantly, no human cases caught within the UK from anything other than bats since, way back in 1902.
Okay, so basically very low risk in the UK unless you've traveled or had contact with a bat.
That's the gist, yes. And the notes do specifically mention that rabies-related viruses, lyssaviruses, have been found in UK Daubenton's bats, so any bat contact, even here, needs careful risk assessment.
Got it. Are certain age groups more affected globally?
Yes, the notes point out children are disproportionately affected. About 40% of the global deaths are in kids under 15.
That's tragic. Is there any good news on the epidemiology front? Any success stories in controlling it?
Yes, actually. The notes highlight the big success in Western Europe with fox rabies. Widespread oral vaccination campaigns for foxes drastically reduced it. It shows that targeting the animal reservoir can work with coordinated effort.
That's encouraging. Okay, let's move to the clinical picture. What does rabies actually look like in a person? What signs and symptoms do the notes describe?
Well, initially it can be quite vague. Things like fever, headache, just feeling generally unwell malaise, and often some discomfort right at the bite site.
And then it gets worse, moving into that neurological phase.
Yes, that's when the really characteristic and frankly terrifying symptoms start. The notes list anxiety, agitation, confusion, hallucinations, and the most famous one, hydrophobia.
The fear of water.
Exactly. A profound fear, often triggered just by trying to drink or sometimes even the sight or sound of water. Paralysis also develops.
Are there other specific early signs mentioned that might be a clue?
Beyond the flu-like stuff and the bite site discomfort, the notes mention pain, fever, headache, weakness around the bite area, and they specifically call out itching at the wound site, an itch that then spreads to the face.
Itching spreading to the face from the wound. That's very specific.
It is. It's noted as a characteristic early neurological sign, a key thing to potentially spot.
Wow. And the incubation period, you said, it varies?
Hugely variable. Notes say usually 3 to 12 weeks, but they make a point of saying it can be much, much longer. They mention reports of up to 19 years.
19 years. That's incredible.
It is. It makes taking an exposure history really challenging sometimes, doesn't it? So after those early signs, it progresses rapidly into that neurological phase. We've mentioned hydrophobia, hallucinations, the behavioral changes. Then it tends to progress to ascending paralysis, sensory problems, and eventually coma.
And what's the ultimate cause of death usually?
Respiratory paralysis. The notes are quite clear on that.
And let's reiterate this crucial point.
Mhm.
What about treatment once these symptoms start?
Yeah, this is absolutely critical, and the notes hammer it home. Once clinical symptoms develop, there is no specific treatment. It's almost uniformly fatal at that point.
Just devastating. How long do people typically survive once symptoms appear?
The notes say only about 2 to 12 days if untreated. It's incredibly rapid and aggressive.
Gosh. So, remembering those early signs, the pain, that spreading itch, and knowing how bleak the outlook is once symptoms start, it really puts the focus on diagnosis and, crucially, prevention, doesn't it?
Absolutely. The window for intervention is everything.
So if rabies is suspected, maybe based on symptoms and exposure history, how is it confirmed? What investigations do the notes mention?
No, right. So diagnosis is a mix of the clinical picture, that detailed history of potential exposure, and lab tests. The notes do say that diagnosing it before death antemortem is tricky, but it's getting better.
What sort of lab tests are we talking about?
Well, confirmation relies on actually finding the virus, or parts of it, like its antigens, or showing that the patient's antibody levels against rabies are rising significantly, or detecting the virus's genetic material, its RNA, in samples.
Which samples are useful? What tests do they mention specifically?
They list testing for rabies antibodies and looking for the viral RNA in saliva or cerebrospinal fluid, CSF, and they specifically highlight the growing use of something called a neutral skin biopsy.
Neutral skin biopsy, what's that?
The notes explain it's taking a small skin sample from the back of the neck, the neutral area. It's useful because the virus travels along nerves, and there are lots of nerve endings in the skin there, so you can often detect the viral antigen using a fluorescent antibody test.
Right, okay. That's a specific one to remember. And after death?
Post-mortem, it's usually confirmed by finding that viral antigen in infected tissue, typically the brain, using smears or biopsies. The notes also mention newer molecular tests are showing promise for improving diagnosis overall.
Is imaging, like CT or MRI, helpful at all?
Generally not, according to the notes. An EEG might show some nonspecific slow-wave activity or even be flatline in really severe cases, but it's not diagnostic.
And what about the suspect animal, if you think an animal might have it?
The standard procedure mentioned is to quarantine the suspect animal for 15 days and observe it. If it shows symptoms or dies, its brain tissue is examined for the virus. That's often how bat exposures are confirmed.
Okay, so key investigation takeaways. Think saliva, CSF, that neutral skin biopsy, and brain tissue. Right. Knowing how awful it is once symptoms start, management has to be about acting beforehand. What's the crucial management message from these notes regarding potential exposure?
This is probably the most vital section. The notes state right up front, and it's worth saying again, there's no cure once symptoms begin. So management is almost entirely about post-exposure prophylaxis. PPE.
PEP. And what does that involve? What are the absolute must-dos?
3 crucial steps done immediately. First, immediate and thorough wound cleansing. Second, giving the rabies vaccine. And third, for people who haven't been vaccinated before, giving rabies immunoglobulin, HRAG.
Let's focus on that first step, wound cleaning. Why is that so vital?
The notes really stress immediate washing, soap and water, really thoroughly. The idea is to physically remove as much virus as possible from the wound before it gets into the nerve endings and starts its journey. Simple first aid, but incredibly important.
Okay. What if someone gets bitten here in the UK, say by a dog? Is that considered high risk for rabies?
The notes clarify this. In the UK, bites from animals other than bats are generally considered no risk for rabies. That's because of the UK's non-endemic status. But this is specific to the UK context. If the bite happens abroad in a high-risk country, it's a totally different ballgame.
So for bites in those high-risk areas, it's straight to PP.
Absolutely. Wash the wound immediately, then get medical help for the vaccine, and, if needed, the immunoglobulin, urgently.
And how well does this PPP actually work?
The notes are emphatic. It's highly effective. Combining that wound cleaning with the immunization basically prevents the disease developing. They state death is almost certain without PP before symptoms start.
And the UK uses a specific risk assessment process.
Yeah, Public Health England, PHE, has guidelines. They assess the exposure risk level, which then dictates exactly what PP schedule is needed.
And if someone does develop symptoms, despite everything,
Tragically, as the notes say, treatment is then purely supportive, managing symptoms, keeping the patient comfortable. Antivirals haven't worked.
do healthcare staff need special gear when caring for someone with symptomatic rabies?
Beyond standard infection control, the notes say no extra precautions are needed unless staff get bitten themselves or directly exposed to infected tissues.
Have there ever been any survivors? It sounds so bleak.
It is bleak. The notes mention survival is extremely rare. The few cases have mostly been in people who were either vaccinated before exposure or received very prompt and complete PEP after exposure.
Can you just run through those post-exposure treatment schedules again? How they vary?
Sure. So, the rabies vaccine is always part of PEP. If the person hasn't been previously immunized, they also get human rabies immunoglobulin HRIG. That gives immediate passive protection while the vaccine kicks in. The exact schedule depends on the PHE risk assessment. None, low, or high. None risk. No jabs needed. Low risk. If you're not immunized, it's 5 vaccine doses. Days 0, 3, 7, 14, and 28, 30. If you are already fully immunized, it's just 2 doses. Day 0 and 1 between day 3 and 7, high risk. It's the same vaccine schedule as low risk, 5 doses if not immunized, 2 if immunized, but you also get the HRIG infusion on day 0.
Right, so maybe a way to remember PKP is something like WVI, wound cleanse, vaccine, immunoglobulin if needed.
Yeah, WVI, that works, captures the key actions: wash, vaccinate, immunoglobulin. And the absolute key word across all of this in the notes is immediate.
Because once symptoms appear,
the prognosis is dire.
Which brings us to prognosis. What do the notes say about the likely outcome once symptoms do show up?
Yeah, unfortunately, it's stated as almost universally fatal once symptoms develop.
No real chance at that point.
Yeah. The notes link any survival directly back to preventing the disease reaching the symptomatic stage through prompt PE. Without treatment, it's rapid progression to coma and death, usually within days.
Okay, so given that grim reality, prevention is clearly everything. What wider prevention strategies are mentioned in the notes?
Well, the ultimate goal mentioned is eliminating rabies in the animal populations that carry it. That needs a big collaborative effort: governments, health bodies, surveillance.
How do they tackle the animal side?
Key things are vaccinating domestic animals, especially dogs, and controlling stray populations. And they mentioned that European fox success story again, showing animal vaccination really does reduce human risk.
And protecting people directly.
2 main ways: avoiding contact with animals that might be rabid, and immunization, so pre-exposure vaccination for those high-risk groups, lab workers, animal handlers, certain travelers, and then, as we've covered extensively, that vital post-exposure vaccination using both the active vaccine and the passive HRG when indicated.
Right, so control the animals, protect the humans through avoidance, pre-exposure jabs for some, and immediate post-exposure treatment for anyone potentially exposed.
That sums it up nicely.
Lastly, in those final stages, what actually causes death? What are the complications listed?
The main physical complications listed are respiratory failure, cardiac arrest, and then multi-organ dysfunction. The notes also touch on the huge psychological and emotional toll, obviously, given the prognosis once symptoms appear.
Well, this deep dive into your MSRA notes on rabies has really hammered home just how devastating this disease is if it gets established.
Yeah, it's a stark contrast, isn't it? The almost certain fatality versus how effective prompt action can be.
Exactly. I think the absolute key takeaway for revision from these notes has to be the critical nature of that post-exposure window. Knowing the potential exposures, recognizing the early signs maybe, and understanding those urgent PPS steps, WVI, wound cleanse, immunoglobulin, that's incredibly high yield. So thank you for sharing these notes. It's been really valuable to go through them.
Definitely. Prompt action saves lives here. That's the message that really comes through.
And if you listening are looking for more revision resources, especially geared towards MSRA, check out PassThemSRA.com and also FreeMSRA.com. Thanks for joining us for this deep dive.